and welcome. My name is Marybeth Antone. I'm the Associate Vice President for Operations at Silver Cross Hospital. February is Heart Month, and we thought it would be great to tell you a little bit about all the wonderful heart services we have here at Silver Cross Hospital. Today we have Dr. Ravi Ramana here to tell us a little bit about our TAVR program, which is going to debut this spring. Dr. Ramana, tell us a little bit about yourself.
First of all, thanks for having me here today. It's an exciting time, obviously, here at Silver Cross Hospital, and happy to be a part of it. In terms of my background, I'm a trained interventional cardiologist. I went to college in Michigan and did my training for cardiology and interventional cardiology here in Chicago at Loyola. I've been working with the current group that I'm with as well at Silver Cross for the last 11 years.
Wow, that's wonderful. We're so happy to have you here. Dr. Ramana is the medical director of our TAVR program. He's going to tell us a little bit about what TAVR is.
So TAVR is transcatheter aortic valve replacement. It's a therapy that we use to treat patients with severe heart valve disease, specifically severe aortic stenosis. In the past, the traditional way to take care of this disease was open heart surgery with valve replacement. But over the last 20 years worldwide and over a decade here in the United States, we've been using TAVR as a way to treat these patients in a much less invasive way. Typically, we do this procedure by making a small incision in the groin and inserting tubes and catheters up to the heart. This allows us to replace the aortic valve without needing to open the chest and put the patient on the heart-lung machine.
So Dr. Ramana, tell us a little bit more about the team of individuals that are involved in the TAVR procedure.
Great. So there's a lot of people involved. Here at this hospital, we're going to have cardiac anesthesia involved. Obviously, the cardiologists are involved, and the heart surgeons are involved.
Okay.
We also have team from the cath lab as well as from the operating room.
Excellent.
And although that's a lot of people in the room, the reason they're there is we need to be ready for any and all things that can happen. Fortunately, this procedure goes smoothly most of the time. In the rare instances that things changes, the patient becomes unstable, we need all those people in the room to be able to shift our therapy to make sure that we have the best outcome for the patient.
Excellent. Thank you. So Dr. Ramana, why is it important that we have this procedure here for our community?
I think it's important to bring this procedure to our community because it's now become standard of care for some of these patients. When we first started doing TAVR almost a decade ago, it was a little more experimental in the beginning phases. But as we've improved, as the technology has improved, it's become the standard of care to treat severe heart valve disease. And I think that this community needs that here in their backyard.
Excellent. Thank you. So there's been an incredible amount of planning for this, hasn't there?
Yeah, there's been a lot of planning. This has been going on over a year, and luckily Silver Cross Hospital has been great in having the foresight to understand the amount of time and energy and planning it takes to go into a program like this.
Excellent, excellent. So for those of you who've visited our campus or have been past the hospital, you see on the east side of our campus a very large construction project. This is our new $22 million expansion that we have had in the works probably for the last 2 years when we started open heart surgery in May of 2019. And the next step in the process was to expand our capability to be able to do these types of procedures, these TAVR procedures. So this building actually is going to be operational within the next month. We hope to do our first TAVR case when?
Sometime this spring.
Okay.
Team will be ready to go.
Okay. I understand, too, that Mick Jagger had a TAVR procedure. So is it just for old rock and roll guys, or is it for, who's it for?
That's a great question. It's a question we ask ourselves every time we see a patient with heart valve disease.
Okay.
Age is not the only thing. So initially when we started doing these procedures about a decade ago, it was the elderly patient, the 85 to 90-year-old patient. But as technology has improved and our experience has improved, it's been shown not only locally but worldwide that this patient can be used in younger patients. So really any patient that has severe valve disease should be seen in a multidisciplinary clinic. Okay. And it's great that Silver Cross is starting one of their own.
Excellent, excellent. So you have, as our medical director, been responsible for working with the entire team to put this program together. How many of these procedures have you done?
I've done about 500 of these procedures.
Wow. Okay. So we've got some great expertise here. That's absolutely fantastic. Anything else you'd like to add about the TAVR program or just Silver Cross Hospital in general?
No, I thanks for the opportunity to be here today to talk about TAVR. It's definitely been a very exciting time at Silver Cross with the opening of heart surgery with Dr. Pappas and his colleagues, and that's been off to a great start. So I'm just honored to have the opportunity to be a part of the team to bring TAVR to the community.
Excellent. We're very happy to have you too. Thank you very much.